let you know, my name's Katie McClure. I'm the current chair of the British Computer Society Health and Care Scotland at the moment, and it's my pleasure to help set up talks. Any sort of talks you would like us to run, please get in touch, let us know. All our webinars are recorded and the links are made available afterwards on the BCS pages. And just to let you know who we've got today, I'm delighted that one of my colleagues from the NHS has come along to talk on a very interesting subject. And I had the pleasure of interviewing Gary during work about what they do, and I thought it would be an absolutely excellent idea for a talk for BCS. It covers a lot of ground for everybody in all our governance and fraud prevention and cybersecurity and so on. So without any more ado, I'm going to let Gary introduce who he is. He'll maybe mention that he's been doing a course, because I'm delighted to hear he's handed in his final assessment. So Gary, we really want to hear from you, so I'll hand over.
Thank you so much, Katie. Good afternoon, everyone, and thank you for coming along, and thank you for inviting me along today. Katie's asked to provide a 30-minute talk with some time at the end for some questions. I'm more than happy to take as many questions as this topic brings to your attention to put to me. And yeah, we'll go through it. I've called it a general fraud awareness. This isn't one off the shelf. I've made this up over the last couple of days, but I hope it meets the brief and hits the mark today. As Katie's explained, my name is Gary Watt. I'm one of the counter fraud specialists at NHS Scotland Counter Fraud Services. I've been in the investigation teams with Counter Fraud Services since 2018, having joined the organisation in 2014, and I've been with NHS since 2009. So I've been able to build up just a little bit of experience, and once I worked out what counter fraud do and what they were all about, and decided that was the goal for me. So I'm delighted to be there now and quite enjoy it in the investigation team. Kate touched on just away from work, I took a bit of an interest in fraud, and I was enrolled at the University of Portsmouth just to do a degree in counter fraud and criminal justice. So that's taken up the last sort of 5.5 years of my life, along with a wee boy. It's been a great time, starting a new job, got a child, and then start a degree via distance learning. So it's been pretty full on, but I'm delighted to say that the dissertation is gone. And a final assessment as well, just to finish the module is also. But enough of that. If there's any questions, please put them in the chat. I'll cover them at the end. Hopefully there's time. I will try and go through this presentation in 30 minutes, hopefully. And I'm happy to stay on for 15-20 minutes at the end and cover any questions that came in at the chat. So if you have any questions, at the end, we'll go through them. Sometimes what I find with these bits is nobody really has any questions during it, but then somebody asks one question and then it just sort of snowballs. So we'll see what happens, but no dramas if you have no questions.
Gary, can we ask you to adjust your microphone? It's a wee bit, that sounds not great quality.
All right, no worries. Is that any better there? Or?
Wee bit closer to your mouth, I think.
How's that?
Keep going. I'll interrupt again if it's not right.
Any better now? Is it better now?
Yeah.
Okay, we'll try with that. I'll try and speak a bit louder. Normally I'm standing up, this is the first time I've ever delivered one of these sitting down. I'll definitely try and speak up. So by way, what I hope to sort of cover this afternoon is who are counter fraud services, what do counter fraud services do, what is fraud, is there fraud within the National Health Service, and why does it matter, as kind of a few brief topics that I'll go through. First one is, who are PFS? I'm not sure if everyone has heard of us, and normally even when we speak within the health boards, not all our staff are aware of who we are, but we are NHS Scotland Counter Fraud Services, and they were established back in July 2000 with a very basic remit. They looked at ophthalmic, dental and medical, and they were there really to prevent fraud and investigate any fraudulent activity that was identified. In 2004, the role was extended to provide a counter fraud service through the prevention, detection, investigation of financial crime against NHS Scotland. So essentially what happened in 2004 was the remit was expanded. So as part of National Services Scotland, as a specialist health board, we provide counter fraud service to all health boards within NHS Scotland. And we do that by having a prevention team who come up with prevention initiatives. The intelligence team are based within detection, so our firewall, all allegations that are coming in, and then in the investigation team, we investigate financial crime. Essentially, we police the NHS. We have the same powers as the police, albeit I can't arrest anybody. That's pretty much the main difference. But if it is financial crime, it should come to us. It's getting much better working with Police Scotland. They're able to identify it at an earlier stage if they're getting any allegations. And obviously, we try and promote ourselves the best that we can, but we do the investigation in the exact same manner. And we report direct to the Crown Office here in Scotland. Again, we work on behalf of all the health boards. There's 14 territorial and 8 special health boards. We have a partnership agreement, which is quite handy, and that allows us to do our function in all the health boards. Obviously, data and stuff that can be quite difficult to get sometimes, or the boards don't feel like they should be sharing certain stuff with us due to data protection, etc. But the partnership agreement is our sort of Bible, and that allows that to happen lawfully. We work with various other law enforcement agencies, just to name a few: Police Scotland, the UK Home Office, the Department for Work and Pensions, the Identity and Passport Service. These are all really important partners. The sharing of intelligence really helps us fight crime, basically. And the law enforcement agency, the more that we can feed the intelligence system, the more everything becomes joined up. And we just never know what you're going to come across the links that are met when we're investigating crimes.
Sorry, Gary, the sound's going a bit again.
I'm really sorry. Is it better now?
Give it a go.
I'll try for you. Why is it important? NHS Scotland has a huge budget, £19 billion. So that's why we have a job, is to try and protect that as much as we can. Various academics will try and put a percentage of what's lost to fraud each year, but they never agree. But even a conservative estimate, if we apply a 1%, the figure is massive. So that's why it's important that we do what we do. Specialist reporting agency, what that means is that we can report direct to the Crown Office. So a lot of the stakeholders that we meet and a lot of people that we meet whilst on our travels and whilst we're investigating think that only Police Scotland can investigate crime. It's incorrect. There's various specialist reporting agencies in Scotland, and counter fraud services are one of them. And again, it just means that we don't have to involve the police. We do our work in the same way as the police, and we then make the report direct to Crown Office, who ultimately decide if there's going to be a prosecution. And we just do the investigation and report the facts. In Scotland, fraud is known as what's a common law offence, and it's essentially made up with 3 main elements. Now, when we're investigating or looking at a fraud in any capacity, these are the 3 elements that we're looking for. These have to be met in order to have the crime of fraud being committed. If any one of these are missing, it's unlikely to be a fraud, and it's unlikely to be an investigation. That's not to say that we might go back to the board and put measures in place to try and protect resource and make improvements to processes, etc. But if we think of fraud as a crime, there's always a falsehood. It's normally made in words, writing, or by the conduct of an individual with the intention to deceive or defraud. And the practical result has to have been successful in terms of gaining an advantage for the person that has made the cheat. And that they are the three main elements. It is pretty straightforward. And when our team and the investigation team, these are the 3 bits that we are focusing on to see if evidence exists in terms of that. And that's what we're always looking for. The fraud triangle, I had to try and get a bit of my university studies in this somehow. And a particular guy called Donald Cressy, who was a criminologist back in the 50s, and he designed what's known as the fraud triangle, an attempt to try and understand why people commit fraud. And he came up with three main essential elements, a bit like the crime, but completely different. And he says in order for a fraud to take place, he believes that these three elements I'm going to touch on must be complete. So the motivation, normally financial, so a fraudster is potentially in debt, maxed out credit cards, or looking to live a life out with their means, fancy holidays, fast cars, things like that. Revenge is often a motivation, and we definitely see that in the corporate world, where people can seek revenge against their employer, they feel that they've been hard done by, maybe never got a promotion, and that is their motivation for committing a fraud. And simply pressure for results. Sometimes it's not even to benefit them, can personally, but the benefit can be linked back to them if they get to keep their job, for example. So that pressure for results can become a motivation. He then goes on to say that he looks for justification. People justify the fraudulent activity by declaring that they've earned it and they're entitled to that, that it wasn't coming from the managers, so they took it themselves. Within the NHS, we see this quite a bit when we sometimes speak to subjects, or once the whole episode's passed, that they'll maybe come out and they'll want to speak to us, or they'll speak to someone that then gets back to us and say, I don't want anybody who suffer. It's the NHS, they're huge. I was only stole £1,000, I only defrauded them of £1,000. It never made a blind bit of difference, but it's just incredible. And this is, it was a one-off. I believe it's rarely a one-off, it's normally a tester, and there might be a long passage of time, but they'll always go back to say, I got away with that. But he believed that sometimes to justify their action to themselves, it's just a one-off, I'm skint this month and I won't do it again and I've not been caught. And that's how a fraudster would justify their actions to themselves. And then, of course, we can come in to try and close this one, is the opportunity. Lack of procedures, just no procedures, we've come across that before. Custom and practice, again, we've definitely seen that. And loopholes, and that's what the fraudsters are looking to exploit. And it's our job and other organisations' jobs to really tighten up procedures, close any loopholes, and make it more difficult. It's hard to say that you're going to make it impossible. They always find a way. The best law in the world will never completely eradicate fraud, but we can definitely make it tougher, and we can make it tighter. And as things develop, as you know, fraudsters develop in the same way, and they always find ways. Now, what Cressy was essentially saying is, in order to stop a fraudster committing fraud, if we can take away one of these triangles, he believes that it's almost impossible to commit fraud. The reduction is huge. Some people agree with him. I'm just in my opinion, I agree with this slightly, but I think there's various other reasons. But it is one good way to try and understand why somebody commits fraud, and then looking at it to say, this is how we can definitely fight fraud. If we can have a look at removing maybe the motivation, the justification, of the opportunity. The opportunity is obviously the easier one, but we can definitely still have an impact on motivation just by doing proper checks, making sure managers are looking after their staff and they're aware of circumstances, and if they know they're in debt, are they getting the right support and things like that. And these are often ones that things are missed. It's often there's loopholes in here, and you need to shut them, or you need to do a piece of work in there and get that shut. But it's not always the answer. So that's just a wee flavour of something that I grabbed from the university books that's sort of well known in the fraud world, Donald Cressy's fraud triangle. Hopefully this is interesting. We find this within the health boards that this is the interesting part. What I'll do now is I'll just try and give some examples. I may change some of the context just to keep it a bit unknown, but this is based on stuff that we've investigated and cases that have been right through. So none of this will be like ongoing investigations or anything like that, but this is the kind of frauds that we'll maybe investigate from what we see in the NHS, and hopefully it is of interest. SSTS is the NHS sort of time recording system, and it's used to put through overtime amongst other things. I'm not an SSTS expert, however, what we do see a lot of is the abuse of overtime, and this can be as simple as people working in collusion where they are authorising their friend and their colleagues overtime. Sometimes they do the shifts, sometimes they exaggerate a 6-hour shift to a 12-hour shift. Sometimes they're just not there, and you can see when the audit log at the back end of the system that they wait until the event's passed, they log in and maybe put through a 12-hour shift for Katie on the Saturday that she did not work. And then when you look at the collusion cases, you can see that it was replicated on the Sunday, and Katie put through for her other friend the 12-hour. And we've seen that done on a large scale, not just one shift. A real intent over kind of a 6-month period, where when you have the data and you look at it, you can see the logins, you can see the same 2 people or 3 people, however many people are involved in that, and then you pull the ward notes, or you pull information for the systems that they must use on a daily basis to say they were never here, they never clocked in, they never swiped, and they were never in the system they have to be in. And it becomes really apparent that it's just a kind of straightforward fraud. Expenses, again, just over inflation of expenses, and it can start really small, £5 on top of the fuel every time they put fuel in at the work in the community, and they put fuel through 3 times a week. You know, £5 just add up and add up, and it's not until you maybe interrogate the receipts or you start asking for receipts, because often, obviously, the policy will say that the receipt must be there, and then you speak to the manager, and the manager says, time to check the receipts. A kind of high trust environment, low bureaucracy. I'm trying to manage a practice with 20,000 patients in the community, and again, we need to reinforce the message that that's part of their role. We need to check the receipts, and if that's not working for them, they might need to get someone else in, an admin staff, or can support, or bring in one of their colleagues to be checking the receipts, because it could be simple loopholes like that cause massive frauds. And again, if we go back to the triangle, they tried it once, the fiver, they know the receipts aren't checked, and then the behaviour just spirals, and then sometimes when it comes to us, it can be really huge. And then you just get serious parasite, realize throwing their expenses, and the hope that it doesn't get picked up. Bank thefts, again, putting in falsified time sheets to say that they were there, they weren't there. It's as simple as that, as falsifying that time sheet, or duping the bank system, to say that, oh, I was on that shift, I did attend that shift. The reality is we did not, but the bank's managers are based elsewhere, covering large geographical areas of Scotland, and they're not physically there. And again, it's that high trust and lack of staff. This is quite a new one, using NHS vehicles for personal use. We've seen a few examples of this, where staff, unfortunately, are just using pool cars or hire cars that are there for the provision of the NHS services, using them by themselves. One that's went through right through has been with the person actually decided to sell their personal car, and they were just using the pool car, and can be able to see the logs, and basically make up the data package that showed us that there's no way that this car is being used for NHS services, because we know when it moves and it's moving, the person maybe not on shift or NHS services aren't being provided. Working whilst off sick, maybe our most popular referral, and what happens here is from the offset to the board within the NHS in Scotland, generally speaking, you have 6 months full pay, 6 months half pay, depending on your service and what they're doing, potentially working at the agency. Banks have processes where we propose loopholes, and it shouldn't happen. It should be flagged that that person's off sick. But the agencies causes a real issue, and the motivation for working for an agency is the financial reward. These agencies are paying NHS staff a lot of money for picking up shifts, and they're obviously just being topped up with their salary. Again, this one, cost-wise, drugs aren't always dear, and desirable drugs aren't massive cost, but the harm created by creating false scripts to obtain controlled drugs is obviously huge, and it's a real area of concern, and one that we take seriously, to try and put a stop to that, and work with the health boards and the pharmacies to close any loopholes in this area. But unfortunately, we do get stuff coming through like that. Embezzlement, slightly different from fraud. It's another common law offence, but it's a financial crime, so we will look at it. Examples of that: an employee potentially using an NHS credit card for personal purposes. I do have a quick case study that I'll go through, so I won't dwell on that one. Obtaining monies meant for the welfare of a patient or an NHS building. So again, maybe in a care home, for example, normally the patients have a bank account with the care home and maybe no family, or can the family have all deceased and it's an elderly relative that's left. And some of these individuals can have large amounts of money, and unfortunately what we've seen is staff embezzling that money for their own use. So an example would maybe be a shopping spree at Marks and Spencer's, where they've maybe picked up slippers and a dressing gown and some leisure wear, but then got a bit of shopping spree for themselves, and none of that's recorded anywhere, but that's what the funds have been used for. So we've seen embezzlement in that area. And the takings of money is relating to payments made by patients for services received. Again, it would fall under embezzlement. And transferring the monies from a business account to an own account. I've not seen this one for a while, but it has happened in the past, and it could continue to happen again. It's loopholes and procedures where people maybe have control to be able to remove monies from their business account, an NHS account, for example, to their personal account, and having knowledge of the systems and the processes can help to avoid detection. As it is in the town, we deal with theft. We have a lot of high value items within the NHS, like other businesses. One of the examples is the theft of high value surgical items. So this one, if you Google it, you would probably find this one. That was someone for the decontamination unit who was removing lots of sort of scopes and instruments, etc. On a pretty large scale, he was able to sell them around the world to other healthcare professionals. Again, a massive financial loss, in fact, for the NHS to rebuy them basically and put them back into service. High value digital devices, obviously lots of laptops, computers, tablets in the NHS, and we've had allegations where they just disappear, unaccounted for, and we don't know where they're going. And if they fall into the wrong hands, you can imagine it's quite an easy thing to move on. An iPad or a laptop, it's very easy. The PPE, this was rife, as you can imagine, during the COVID pandemic. It was probably one of our top referrals, and I think gloves, for example, don't quote me, but I think pre-pandemic, say they cost around £1 a box. They almost went up to £20 a box, and that's kind of the markup ratio that I was advised at the time. And we're seeing that everywhere, from 1 or 2 boxes to pallets of stuff just disappearing. And obviously the NHS's job is to get the stuff out there into the hospitals as quick as they could. Can't monitor single packets of gloves, for example, so the controls weren't there to that level, but they were highly desirable, and we were losing lots. And again, this theft of other items, touched on controlled drugs, but fuel theft is another one that we've seen. The last one I wanted to touch on was bribery and corruption. It's not a common law offence, it's a statute offence, and it concerns acceptance of gifts, gratuities, or hospitality in reward for awarding contracts or services. Again, it's got high risk in the NHS with a number of procurement contracts. And we've definitely seen in the past and had allegations contracts being awarded based on the acceptance of gifts. We also see collusion with certain contractors when they're creating new contracts or services. So sometimes like it's known as bid rigging, where they're working with the contractor to set up a specification that only that contractor is likely to meet when it goes to procurement. Obviously, that would be investigated under bribery and corruption if that allegation came to us. And the inflationary costs after a contract's been awarded, that's like what it says on the tin, potentially procured at 50,000, and 6 months later the NHS are sitting a bill for 200,000. It's likely that we'd like to have a look at it and make sure the procurement stuff's being followed. Procurement, then bring that to us as an allegation. Again, we would look at that under bribery and corruption. Katie, am I doing okay for time?
Yes, absolutely. Keep going.
Yeah. What I thought would be interesting is to go through a couple of case studies. I've tried to keep it as real as possible. These are cases that have been right through the system, from investigation, prosecution service, and the individuals were dealt with. But I've changed just a few bits just to keep it a bit anonymous. But we've got an allegation for the finance department of a specific health board that one of their staff was using a purchase card meant for the purchases of small value goods, accommodation and travel tickets for personal purchases. So what we were led to believe here was that it was this individual's responsibility to look after the consultants within the board when they're having to travel to conferences, or then maybe go to a different health board to do it at work for a week, and there's numerous expenses and the card to make sure that everything was looked after. Our investigation, so there's a few steps that I've missed, but it did come to us for criminal investigation. And we had a look at it, and we started to unravel the web. And what we found in was lots and lots and lots of legitimate purchases. But then we started to pick out a few odd transactions then for the data. Grocery shopping was one that kept coming up. Now, the meal deals seemed legitimate, expenses, but there was a few sort of odd grocery bills that were in excess of £100 that caught our attention, and we went back to the board and we had no explanation for that, and they never had any receipts or anything for that, so we had flagged them. We now found plane tickets. Again, given what we had heard from the finance department, it wasn't considered odd. One particular one caught our eye just due to the number of consultants that were supposed to be on that flight, and we'd never seen 8 people travelling together through the data. And what we transpired for that is we'd find that we'd actually come across a stag weekend, and that was the reason for the purchase of those tickets. And then on further interrogation, we now started to narrow our dates, and we'd found accommodation linked to that for 8 people. And then there was various activities conducted in another UK city, Scotland, that coincided with where the plane had landed. And so that had now caught our attention. And then we found fancy dress outfits, and then we were really interested. And we couldn't quite understand why. And then basically we put it all together with our subject, and we'd worked out via Facebook and other means that it was a stag weekend, and the NHS had unfortunately paid for this stag weekend. And that is sort of like a real life example, the one that went through. And again, it's just sometimes the data, it was hidden in the data, it's not able to put that thin tooth comb that stuff starts to fall out, and then you can really interrogate and really bring it together. I'll come on to the outcomes for that particular individual just in a moment. The other case study was just to give you an idea of sometimes how the allegation starts with us, and sometimes it can be dead brief, and maybe a member of the public, and hopefully this will maybe demonstrate how we can turn it into an investigation, because some might think that there's not a lot in there. So we received an anonymous Crime Stoppers report which stated that a male individual believed to be employed within a clinical waste capacity is involved in the theft of fuel. The individual is identified with the name Jim. I've changed that. However, a surname's not been provided, and he resides at an address in Inverness. I've changed that, but it was just a city that we got. He's described as being white, in his late 50s, with a stocky bald and grey hair. He drives white truck. He leaves for work around 6:45, returning to and from his home address throughout the working day. He's bringing diesel drums to his home at least twice per week, and he stores them at the rear of the property. The report also states that he brings home other stolen items. So the intelligence team are assessing that information, and not a whole lot, I think it would be fair to say. We've been given a first name with no surname. We've got an address in Inverness. It's not very specific. His description is not going to help us at all at this point. But the trucks is interesting. The 645 is interesting. The diesel drums is interesting. And basically, piece by piece, what we managed to do with this particular inquiry is obviously Inverness would be part of the NHS Highland, I think it's Highland. But we were able to link the city to the health board, so we're able to make contact with the health board. We're asking who drives the white trucks? What part of your board is responsible for the driving of the white trucks? It's this department. It's this department. Perfect. And can we make the inroads like that? And it's something that is just piece by piece like that. And where we got here with this particular one is we found a gym within clinical waste that drives white trucks, and it all started to come together when the city was right. He left for work at 6:45. He shouldn't be going home throughout the working day, but it tied in with the allegation of being involved in theft. So that was quite good. So the next part was we need to see if we're stealing fuel. So he had a fuel card, so that gave us reason to believe. And I'll never forget this was one of my cases, but the first fuel station that I contacted, my name's Gary Watt, I'm from NHS Scotland Counter Fraud Services. I'd like to ask you, you were asking about the guy with the white truck and the diesel drums, and I was like, yeah. And she was, I've been waiting on your phone, and I was just like, okay, why? Well, I've watched them for months. This didn't seem right, and I was like, right, okay. And again, it's that nobody knows who we are. Unfortunately, or not enough people know who we are. What to do with that information when they say it. She knew that it didn't seem right, but she done nothing. She just waiting on us getting there. What we were able to do in this scenario is obtain various CCTV footage. So for a 30-day period, we got all the CCTV every time he went to a fuel station, and every time he filled a diesel drum, as well as refilling his NHS vehicle. And that was enough for us to build our investigation based on that. The difficulty here is the evidence was only valid for 30 days because CCTV is constantly just being rewritten. So although it's likely he was doing this for a much longer period, we can only report on the CCTV that we had. So that's another example, just a live case that goes through our team. What are the outcomes? I've just tried to keep them together. So it resulted in both subjects being interviewed under caution. One of the subjects admitted everything to us during questioning. Another one decided to provide us a no comment interview. It's quite common in Scotland, and it's not an issue. As a result, of the evidence gathered and interviews under caution, we reported both subjects to the Prosecuted Fiscal Service for consideration of proceedings. both subjects in these cases, they pled guilty at the first possible opportunity. The finance team member, so the gentleman that planned the stag do, he repaid all the monies back to the health board and was sentenced to a community payback order. And the collectible waste driver, he was sentenced to a level 4 fiscal fine, so he would have, I think it's 300, it did change during COVID, but he would have got a fine. That fiscal fine also creates a criminal record. He could have rejected that in the fiscal service. It's an offer, and it's to avoid going to trial. But if you get offered the fiscal fine, that normally the Crown Office are saying we're going to take you to trial. However, if you take the fine, there'll be no need for a trial, but you're still getting a criminal record based on the theft. And that's what happened in those two cases. And in relation to the roles with the health boards, both were dismissed for gross misconduct as a result of the investigation carried out the board. So we sometimes work in parallel just to make sure we don't step on each other's toes, but they're completely different processes. There's an internal investigation in the health board and then CFS investigation. It's important that they are completely separate, but we do try and make sure we don't cross each other or get anything mixed up, as obviously these are individuals as well, and we have to be fair. The consequences of committing fraud against the NHS, I've just tried to summarise these. It could result in dismissal. You could be struck off or sanctioned, especially if you're part of a professional body like the NMC or the GMC. You can end up with a criminal record. The reputational damage cost to the NHS. And it could result in financial recovery. So we've seen that with the gentleman with the credit card financial recovery. Albeit he made it, I would have hoped that the board would have sought to try and get, and I do that with every case if there's been a financial loss. And I hope that the boards look to try and make a financial recovery. And as we're just coming to the end, what can you do? Raise awareness amongst colleagues. Please tell people that I exist and counter fraud services exist. If you do have any concerns or any suspicions of fraud within the NHS or anything that could be linked to the health service, please report it to us. If it's not for us, we'll ensure that the intelligence team disseminate that via intelligence sharing networks to the appropriate agency. It might be the police, but if it's one of our other partners, then the intelligence team will make sure it gets to the right people. I'm not on Twitter, however, counter fraud services are on Twitter. Please feel free to follow them. I think they put up quite a bit of material, or it's now known as X, but yeah, that is our footprint on social media. Again, this is normally for the boards, but we're based at the Gyle, at Gyle Square, on South Gyle Crescent. There's a fraud hotline. The fraud hotline number is if you wanted to make any kind of anonymous allegation or report anything to us, please do it via that number. And if you wanted to contact the help desk, you get put through to the right team, likely the intelligence team in the first instance. And that is our website at the bottom. And you'll be glad to know that is the second last slide. And the last slide is just, I'm happy to take any questions that you may have. I'll do my best to answer them.
Oh, well done, Gary. I really enjoyed that.
A lot of information. A bit fast-paced.
Question from Stephen Booth. Do you also look at private sector providers with NHS contracts or that use the NHS? And he's got one example of seen as a nurse in an elder care home who would order refills early on the residents' drugs that had a street value, and when they arrive would remove any left over from the previous prescription. Thoughts there?
This nurse, just to capture the question correctly, this nurse not employed by the NHS would be a private healthcare establishment, and she's working in there with...
Yeah, an elderly care home, and she's working in the private sector. Yeah.
That wouldn't be one that we would investigate, but I mean, I go back to that harm issue that I touched on earlier, and there's potential harm issues associated with that behaviour. That would be one if the allegation did come to us, that we look to make sure that's disseminated
Yeah, because Stephen does mention that it's with NHS contracts or that use the NHS. So, he says it was in England 10 years ago.
All right, okay.
Historic case.
Yeah, no, that kind of behaviour would need looked at. I'm not saying it would definitely fault us, but we'd look to disseminate that. Could
Yeah.
it would have to be done.
Do you pick up much through social media? You're saying about Twitter.
I can't answer that question. I'll be one of my prevention colleagues. I'm not sure what the impact. I think there's some benefits, even though I'm not on the X or the Twitter, but I think there's definitely some benefits. I'm a fan of Stephen Bartley, for those that watch Dragon's Den, and he's made quite a success out of social media, and I believe that that's how we get the message out there. And always try and utilise those channels, especially at the end of an inquiry, and maybe came across a particular issue. I always look to try and get some exposure via social media, but it's not my bag.
And you were saying as well about looking at Facebook for evidence of that stag party. So again, would that be yourselves that would do that?
Yes. So it's open, as long as it's open source, but we can utilise the internet and Facebook if people are putting up their private life on the open web. We can go in and we could take images, for example, and we can evidence something a criminal standard, and that can be done.
And would it be yourselves that look at CCTV footage? Do you go through that by yourselves, or is there another group within the NHS that do it?
It would be dependent on the case, but it would be unlikely that we would involve anyone else from the NHS. So the particular example with the fuel theft, with two officers attending to review the CCTV and then make that evidence recovery, and then it would be reviewed back at base before being compiled into a report. But we wouldn't involve any other agency, and the only agency I can think that we would involve, it wouldn't be with the NHS. It would maybe ask Scotland for assistance if it was complex, and maybe I'd experience deciphering some of these systems are complex, but we wouldn't involve anyone else in the health service.
Yeah. Question from Nick: does the England and Wales NHS also have a fraud unit like yourselves? And if so, do you share tools and techniques for alerts and investigations?
Yes, we do. So the NHS Counter Fraud Authority cover England and Wales, a huge organisation. We do try and work in partnership with them as much as we can. In terms of the intelligence alerts and how they work together, unfortunately, I don't have the answer. That would be one from my intelligence team colleagues. But I would hope that the relationship's definitely there between us and the CFA, and likewise our counterparts in Northern Ireland. We do try and adopt a four nations approach in relation to our work, and we do share. As I say, it's sharing intelligence is key and vital. It does happen, but they're called the NHS Counter Fraud Authority for England and Wales.
And is that repeated in other countries? Is there an international group of counter fraud specialists that work in health services?
Not that I'm aware of.
You might need to get a different card to go and book your flights to go to that one, though, I think.
Yeah, absolutely.
And any other sort of, what was your most sort of common one in amongst dental or medical?
Our most common allegation?
Yeah.
I would say at the minute, sickness, what we define as staff fraud, but sickness absence fraud. So it is the issue of staff being off sick, working elsewhere, and it's not always the agencies. I give an example with agency staff, but it could be working anywhere, just working somewhere else, double money, somewhere where the terms aren't as great on the other side. So the NHS terms are normally quite good, I would say. 6 months full pay, 6 months half pay. So normally we find that the terms aren't the same on the other side, or it's a job that they maybe enjoy, they're local doctor, for example. They like it there, but they don't like working for the health service, but they still want to. I would say that's probably the biggest one from the technical people.
Yeah. It's, as you said at the start, given the amount of money that's involved in the NHS, it's so large. It's kind of inevitable that there will be fraud of some sort, and amongst it, the temptations are all there.
Yes.
Yeah. So what sort of things does your team do to try to prevent fraud?
Probably not best place to answer that. In the prevention team, we have a whole team that deal with that. The big ticket item would potentially be like a fraud risk assessment, with go in at different levels as well in terms of how thorough. Can like a sort of high, medium, or low fraud risk assessment, and they would agree with a health board what area they're going to look at. What are the parameters in that fraud risk assessment? Even if you say, well, procurement's still massive, so it can really draw in the parameters, and they'll go in and do a piece of work looking at everything from start to finish, in terms of controls, policies, process, and potentially going in and meeting the team, or not just meeting the team, going in and seeing the team, how does this work, how does that work, and then developing a report for the health board with actions to potentially tighten up loopholes or tighten up process. Or one of the things I've seen is they'll detail all the risks that they've found.
Yeah.
And then they can put in a potential plan to try and mitigate that risk or possible remove it, but it's not always suitable to remove it, or not always the case that you can remove it. But that's probably their biggest bag. But I'm sure they'll not appreciate me just saying that that's all they do. They must do a load of other things, but I'm not in that team, unfortunately. It's not my bag.
How did you get into counter fraud services yourself?
To myself, so I left. I wanted to be a mechanic. That was never going to work out in the motor industry for me. So I joined the health service, and I joined dental, and I was basically recorded these models that were coming in for approval. And then you do your appraisal, and your manager would always say to you, "What would you like to do? Can it something in the next year, or would you see yourself in 10 years?" And at one point, I used to just keep writing paramedic. Be a paramedic. I'm not going to be doing teeth models. And then I think I maybe came to something like this, where counter fraud just gave us a general awareness. This is who we are, and this is what we do. And it really caught my attention. And not only was I just writing, I want to go to counter fraud, I started making moves to try and get there, to try and understand what I could put in place that would support a future application. And eventually I managed to get in. And then I made it clear that I wanted to be an investigator. So obviously all of my colleagues are ex-police, ex-forces, other law enforcement. Years and years of investigating crime. I've not got that. I've never had that. I've never got it now, but I never had it at the time. So I was always going to be up against it. So they've done a trainee programme, a trainee counter fraud specialist. And I was successful in applying for that role. And that's kind of where it's took off from there. I love it in investigations. I love what I do. I've got an interest in fraud, sadly. Obviously the university stuff, I was happy to sign up to that and give away 5 years of my life. But that's kind of how I've always just an interest, and I'm still interested. You just never know what's going to happen tomorrow. No 2 days are the same, albeit you can maybe strip it back and say, we just investigated a crime. Of course, that's common, but the intricacies and the people that you meet, the things that you're dealing with, they always change, and they're really interesting. So I think that just keeps me hungry and yeah, one way to continue. I really do like it and counter fraud, and that's probably why I was happy to come today when somebody seemed to want to come and speak to us about fraud. I was like, yeah, let's speak to fraud. I can speak about fraud all day.
Of course you can. It's such an interesting area. Nick says, do the computer AI expert systems automatically analyse the ground level stats and data for patterns that may indicate fraud?
I'm just going to be honest. I don't know the answer to that. I'd need to take that one away.
Yeah, I suspect, Nick, I suspect we've got specialist groups. We have AI specialist groups in BCS, so I think go to them and ask that question, I think.
Sorry, Nick.
What's the best part of your job? Sounds like it's investigations.
Yeah, yeah, I love investigating financial crime, I suppose, would be the best bit. So I get presented with an issue, and then that sort of problem solving that's attached to the criminal investigation is probably the bit that I enjoy. So finding what the evidence is there. Once you find it, you need to analyse it. What is it telling me? What further lines of inquiry have to be made? Going through kind of the full tactics that we use to get our end result, and sometimes you need to be clever and you need to be smarter than the criminal to try and catch them, because obviously it's our job to make the report to the prosecutor, and we don't prosecute the court official, the Crown Office prosecute, so it's making sure that if that is the way it goes, and kind of I've established that a crime's been committed, and I believe there's a sufficiency of evidence to support that, about making sure that my report reflects that well. And that one of the other bits, bizarrely, is that open mind. So often when you speak to witnesses or you speak to health boards, and he's a baddie, she's a baddie, they've done it, it's a joke. And these are the kind of means that we have, and it's my job to sit there and I basically ignore all of that. I'm not interested in any of that, but I keep smiling. And then we can start to look, what do we have evidence-wise? What can I look at? What data have we got? What paperwork do we have? I take your point that you don't like that person, because sometimes that's where that comes from. So you don't like a particular person. And I suppose one of the bits that I do enjoy is when we've clarified that it's not, we've proven it's not that person and it's potentially someone else. Going back and demonstrating that open mind can require to investigate into the wrong person. We got it wrong. I suppose that's quite enjoyable.
Yeah. And as we mentioned, you've just finished a university course that you've been doing part-time. And that's what brought you back to my attention, was filled in a survey. Can you tell us a bit about that? Why you did your course, what you got out of it, and what's next?
So I was enrolled onto the course when I started the traineeship to like the trainee chemical specialist. So I was enrolled on, and I completed at least the first 2 years, and should I choose, I could exit, but that wouldn't sort of hinder my progress. So I was kind of forced into it. After 2 years, a discussion with my manager to say, we'll support you to stay on if you wish to stay on. And by that point, I think I'm 2 years in, 2.5, 3, I still had 3 years to go. Still had 3 years to go. So, but I decided to take it. I'd never done a degree. I never went to university. I went to school and just for standard grades, and again went straight into full-time employment. So I'd never been in that sort of place before. I was kind of enjoying it. I was getting the hang of it, and I'd done numerous assessments over the 2 years, so I felt like I was just getting to grips with it. So that's basically why I stayed in it. And then everybody's always saying it'd be a good thing to have. As my career develops, it's nice that it's kind of specialises in fraud. There's only 1 or 2 universities. I think there's only one now in the UK that offer that course. So, and it's quite niche. And then as I'm meeting people in the fraud arena. They're always interested in how you get into fraud. I've done this a lot, and I've hopefully got the degree. I'm assuming I've passed. But a degree in fraud and criminal justice, they've often heard of the degree but never actually done it. I suppose just having that outlook, kind of to that perspective, I think it helped my work, kind of in terms of kind of put forward arguments. Maybe you're doing SBAR papers and you're writing them. I'm definitely writing them in a different way than I would have done 5 years ago. Full of references, kind of supporting what I'm putting forward. So that's probably the biggest thing I've taken in that.
As a fellow mature student, I congratulate you on getting your final assessment in, and I hope it all goes well from there. Gary, it's been fascinating speaking to you. I'm so pleased you came along to speak to us, because I think it needs to be, the work at counter fraud needs to be shouted from the tops of the trees and just get everybody more and more aware of it. And I think particularly in designing systems from the outset and actually incorporating it, getting you guys in early, not just prevention team, but investigation team as well, so that we know what we can do better. Thanks for coming in from people who've attended as well, and they've enjoyed it. So with that, Gary, thanks again, and lovely to have had people attending, and I hope you'll come along to the next one. Thanks, Gary. Well done.
No worries. Thank you. See you. Bye-bye.
Bye.